Hey, what's up? In this video today, I'm going to be comparing the 4 best types of support braces for knee arthritis pain. As an expert physical therapist, I get asked all the time, what's the best brace for a variety of different conditions, but the most that I get asked about is knee osteoarthritis. So that's what I'm going to be answering on this video today. So let me just tell you the 4 different types of braces we have here. And just to make sure that you understand, there is tons of options out there. If you go looking for a knee brace, if you go to your store, like your sporting goods store, if you go to like a local Walmart, Target, those kinds of stores as well, any sort of like pharmacy type store will also have this in their first aid department. And there's many different options. You might find some in the first aid departments, but also in the sporting goods departments of big warehouse stores. This is just a knee sleeve, a basic knee sleeve that does have menthol infused into it. And this is the Copper Fit brand. I'll speak more to the Copper Fit brand in just a moment because I get asked that question all the time too. What's the deal with the copper? Then here we have a knee brace. It's a compression sleeve with metal struts in it, or stays is what they're called. Stays, and it's got a circular buttress around the kneecap. I'll show you more in just a second on that one too. Here is a hinged brace, so it's got hinges on either side of the brace, one for the inside and one for the outside. And then here in this one is an unloader brace. Let me open this up and show you what this looks like. There go the instructions. This is definitely going to be your higher end brace, and I'll explain more about how this brace works and how people use it specifically for osteoarthritis. All right, so let me just start out with the first brace here. This is just a basic knee sleeve. Now it's a Copper Fit brand and it's menthol infused, meaning it's going to give a cooling effect when you put it on. Now I picked all of these up at Amazon, and in case you're looking at getting yourself a brace, there's lots of options on Amazon as well, and you can find all of these on Amazon. So there's a brace. It's really nice material and it's supposed to be menthol infused. So when you smell it, yeah, it smells like menthol for sure. There's no supports, straps, or buttresses, struts in this. I'll show you what those look like in the other braces, but this is just a sleeve. On the inside here, you do have the silicone grippy stuff right here, so it doesn't slide on your leg as much. They still slide a lot. But all this offers is compression, and then the menthol infusion should theoretically give you some cooling effect. Although you could put on like icy hot or another menthol based cream, topical analgesic cream, and put another brace on it. But this is pretty cool. It's kind of saves you the hassle because getting that stuff on your hands is a bit of a hassle. And they come in different sizes, so just be aware if you decide to get yourself one, you might need to try on different sizes. I'm in a large XL. They usually come in small, medium, and then large XL, and then double XL, triple XL, and so forth. And I think they have extra small too, or like a kid's size if you're that small. And so to put this on, it's really simple. You just shove your foot in there. So I'm going to get this on. Let's move these out of the way. And you just slide it up on your leg. Get it on so that that design goes right over your kneecap. The words are up and down right there. You can read the words. And there's no right or left. This is a one size or one brace for both. And so are these other 2 braces. Only this one is one that does need to be for the specific side. I'll talk more about that in just a moment. Now, having this brace on, let me stand up with it so you can see a little better. It offers compression, so it is squeezing right here on my knee. Now, it does allow full range of motion, so it doesn't really restrict you a whole lot. It just feels like really tight pants right around your knee. And that can give a very helpful benefit. That compression feeling can make your knee feel better. Now, it's only short-term relief that you're getting here. There's a whole big process to getting long-term relief for knee arthritis. But in the short term, a sleeve like this can offer you some relief. It may be enough to avoid taking Tylenol, ibuprofen, or whatever other medication you're taking, or at least reduce the amount of it. And if you've got a busier day ahead of you, like you're going to be taking care of your house or outside doing chores, outside taking care of errands, then you might slip on a brace like this to make sure that you have a little bit of relief. This is definitely the cheapest option and the easiest to put on, the easiest to manage. There's all kinds of different brands out there, styles, colors. Some have the little hole right here, the patella, the kneecap hole. I'll talk more about that here in a second. These stay on the best usually because they don't have brackets to slide them up and down. Now, with braces, generally, the more you pay, the better quality materials you get. With this copper fit brace, this one's copper infused, so the inside, you can see the kind of goldish tinged fibers in there. The only thing that does is it's an antimicrobial, so it's supposed to keep this smelling better for longer, so you don't have to wash it as much. Oh, and by the way, I do feel the cooling effects of the menthol. It's still on my knee here, even after I took off the brace, and you could smell it. It's not real strong, but you can definitely catch some whiffs of it, and it smells nice. It's not really bad. But going back to the copper, it is not, there's nothing special about the copper with making your knee heal faster or heal better. It doesn't really involve healing at all. It's just to keep the brace cleaner. And if you look at the Copper Fit website, that's all it says. It's an antimicrobial. So that's the big deal about the Copper Fit, which is cool because these things get sweaty. You know, if you're wearing them all day long, you have to wash them. I always recommend you get, once you find a brace that you like, get 2 of them, especially if you have a more chronic problem like knee arthritis. Most people using knee braces aren't just using a knee brace for, you know, a week or 2. They're usually using them for months, and it's worth it to get 2 of them so that you can put one in the wash while you use the other one. You have one available. You're not out of a brace. So a basic knee sleeve like this is only going to give you short-term support, and it's going to mainly offer some compression, not much on the stability side. Now let's talk about stability from one of our more sturdy braces here. So we're going to open up here. I got the McDavid brand knee compression knit sleeve. We got something on there with gel buttress and stays. I don't know if you could see that right there. I've got a link in the description below. But just to open it up and look at it, here it is upright. So this one has the stays right here on the sides. That means that it's got these, they're not metal. I'm not sure what material they are, but they're really bendy, and they spring back to their correct position. They offer some support, but they're not really intended to give you tons of support. There's better options out there. So if you feel like you benefit from one of these, then definitely wear one of these. This would be better if you have like a meniscus problem or a ligament problem, like an ACL tear, a meniscus tear, something like that. Now, as far as the research for these stays right here, I couldn't really find much on the research. In experience with patients and in treating patients, I do have patients that tell me that they prefer these because the brace is just a little bit stiffer compared to one without any stays. You see how that one just flops over? Versus if I hold this one in the middle, it stays straighter. But it's not, I mean, it doesn't take much to overcome it. I can easily bend those stays. And the other thing that this brace has is this gel buttress. This is what it's talking about on the cover. Let me just flip it inside out. So it's got this gel pad that surrounds your kneecap. So it's supposed to cushion your kneecap. I guess if you have sensitivity around your kneecap. I don't think it's going to really keep your kneecap in position. I think that's what people assume. I'm not sure that they market it like that. I don't think that they do. But your kneecap is going to move under your skin. There's no brace to really keep it in place. It's more of a muscle control and strength thing that you need to worry about to keep your kneecap in place, because some people do have shifting kneecaps. The patella can almost dislocate or even completely dislocate, especially in very flexible people. But a brace like this isn't going to keep it in place completely. It might compress the area and help to make it feel better, help to offer some compression so it doesn't move as much. But if you're still moving incorrectly, if you don't have good strength supporting the knee and the patella and all that, then this brace isn't going to completely solve the problem. But this could be a little bit better than this one. And of course, it's going to cost you a little bit more. I'm not 100% sure on the prices. If you go check those links out, you'll see the prices for all these braces. But generally, the simpler the brace, the cheaper it is, the more stuff it's got on it, the more expensive it is, and the better quality of the materials, the better you're going to pay as well. Which I think that's important, because if you get good quality materials. They don't stay stretched out as much. They don't stretch out as fast, and they also last longer, so you can wear them over and over again without having to get a new one so often. So let me show you the brace with hinges next. Now this one I definitely recommend to certain clients that have ligament problems. When it comes to osteoarthritis, however, I tell them it's optional. With osteoarthritis specifically, I tell people buy one of each brace with the intent of returning the ones that you don't like, and you might be okay with say these two, and maybe you like these two, or maybe just these two, and you see what works best for you, because your clothing, you know, how you wear your clothes, the temperature wherever you're at. This is bulkier, so this might be hotter. You have to decide for yourself what works best for you, and you just have to try them out and see. And even the sizes, because especially if you're ordering one online, if you get a large, extra large like this, it might be too big or too small for you. You might get a size up and a size down just to be sure that you know exactly that you have the right fit. Now this one does have the hinges inside, so let me just show you how that works right there. You can see it, you can see the cloth bending around the hinges, and it's a double hinge, meaning it's got two joints right here just to make it bend kind of like a U instead of a V, because that's more like how your knee bends. There it is right there. So generally all hinged braces are double hinged, and this one is sewn in, so you can't get that hinge out, which makes it a little more challenging to wash. Sometimes you can get the hinges out of the brace, and then you could throw this in the washing machine, but you're going to have to hand wash this likely. There's hopefully instructions on the box there. And then you've got these straps here that help to really secure the brace on, because these do tend to slide, so having these straps is essential. You've got the gel buttress right here for the kneecap. That's where your kneecap's supposed to go. Again, it's not holding your kneecap in place. It's just supposed to protect your kneecap in case it's sensitive. So let me get these two braces on and show you what they look like when you put them on. All right, so this one just slides in just like the other one, and it's got those stays on the side. You get it centered over the kneecap. There's my kneecap, and it's very comfortable. It's compressive, of course, so it's a little tight. Let me put this one at the same time. Again, these are both for right and for left. There isn't a dedicated side that they're designed for. You just slide it on. This one's going to be a little tougher to get on. And then once you have your kneecap in place, you just get these straps on and put them on firmly, but not so firm that it's cutting off your circulation. It's just supposed to be firm enough to keep it from sliding up and down. So there's the hinged brace. Now you can see I get resistance when I bend my knee right there. I'm at 90 degrees. I can't really bend it further without meeting a lot of resistance, versus this one I can bend a lot easier. I mean, my knee doesn't want to stop until right there. I'm probably at about 120 degrees, at least 110 degrees. This one, I get to 90 and it already wants to stop bending. So it just restricts your motion. Now straightening out, I don't really have any problems on both sides. It's just the bending that this one slows you down on. It can bend all the way, just the brace thickness, the design of the brace is designed to not allow you to move as easy. So if you have a buckling knee problem from your arthritis, like your knee gives way, this is definitely a better option. But realize with both of these braces, they're not going to fix your arthritis problem. I'll speak more to that here in a second. Let me just get through all the braces. These are just intended to give you some short-term relief, and depending on your specific needs, you might need a thicker brace, a thinner brace, or one without any side stays or hinges. Gosh, I can't even kneel on this one. That's good. All right, so that's what they look like when they're on. And I can squat in these braces. I can move pretty freely. Just this one's a lot more compressive than this one. I'm sure the straps add to that, but also the materials are a lot better on this one. So this is a very well-built brace. If you have more severe symptoms, I would definitely recommend getting a brace like this one with the hinges and more compression than something like this. If your symptoms are less severe, then put this one on. But like I said earlier, get multiple braces because you're going to want to try them out and not just commit to one. What I see people do sometimes is they'll get one brace and make their decision on braces off that one brace experience. So they'll say, yeah, it didn't work for me, didn't really like it, it kept sliding off, and all they needed to do was get a size up or a size down or just a different model, different style, and it could give them tremendous support so they're not having to go back to their doctor for medications, injections, and possibly even avoiding a surgery, so that it gives you some time to go exercise. Because you can exercise in these and potentially feel a lot more comfortable doing it rather than forcing your way through exercise and being in pain. And let's get to the unloader brace now. So what is an unloader brace? I've actually done another video where I review this one, and these are very interesting braces. They're definitely more new. These braces have this little metal piece inside right here. And I'm not gonna show you how to do it on this video, it'll take too long. I've made another video where I actually take this thing apart and show you how it works. You can go find that in the links in the description below. But you can take that little metal piece out right there, and there's another one right in there, there's a smaller one. And those metal pieces, you insert other ones that it comes with. Let me show you real quick. Comes with some tools as well, because this is a more sophisticated brace. So these are little extension blocks. So the bigger piece you put in, the more it stops you from extending. So this one can really completely stop you from straightening out your knee all the way or bending it, and there's different degrees you can stop it at. So this one's set for 90 degrees, but you can make it stop at about 45 degrees, or you can keep it from straightening you out all the way and keep it to, like, say 10 degrees or 20 degrees. And that's really useful if you know what you're doing. Like if you know that if you reach a certain part of bending that you want to avoid and you're more active with exercising, then this brace can be helpful for limiting your motions, so that you're not aggravating your arthritis. The joint lining gets inflamed in arthritis, and this helps you from aggravating that joint lining. Now, another cool feature that most people are using this brace for is the offloading or the unloading part of it. So let me show you what that looks like real quick. This tool is important for this because what you do is you put that right there and you turn that little screw right there, and can you see how it angled that way? And if you turn it the other way, it angles the other way. So the idea here is that it's shoving your knee inwards the more you angle this part outwards. So let me put this on and I'll show you what I mean. There's a process to putting this thing on, so I'm not going to take you through that right now. This is already set up for me. Like I said, it's in the other video. And this is definitely a higher end brace. This brace is going to be over $100 in the $150 range. But for you, it might be very beneficial, especially if you know that you have osteoarthritis on a particular side of the joint. Like they'll talk about compartments in the knee, the medial compartment and the lateral compartment. That medial means inside of the knee, lateral means outside of the knee. And so if you know that you've been told, based on your x-ray or your MRI, that your knee arthritis is more in the inside part of your knee, the medial compartment, or if it's more in the outside part of the knee, then you might choose to get an unloader brace like this. This one is specifically built to offload the inside part of the knee. So the theory is that if your arthritis is more on this part, and maybe even you're starting to bow leg a little bit, if you get a brace on like this that pushes this pad with the hinges this way, it takes pressure off the inside part of your knee. They sell another version of this brace where it's on the opposite side and it pushes your knee that way, so if your knees are collapsing inwards and you know that your arthritis is more on the outside, then theoretically you're supposed to buy the other side brace, turn it so that it pushes your knee right here going that way. I hope that made sense. It's a little complicated. So I'm just gonna adjust the brace here. I don't know if you could see it pushing inwards on my knee there, and then here it's offloading. So here I'm not loading it up. Basically, there's more pressure on the straps, and then if I turn it the other way, it's loading against my knee right here. So there you go. Let me stand up so you can see this one. And this one really blocks me right there. I can't bend much more. And I've put it on with the other blocks, and it stops you very well in whatever side you decide to stop it on. So there's that brace, and it is bulkier, obviously. So, you know, wearing this under pants isn't going to be very comfortable unless they're loose-fitting pants. And it just, like right there, it stops me. I can't, if I try to go down more, my left knee can go quite a bit, but that knee does not want to go anymore. So I like that feature about it in case you're using blocks for this. Now, as far as evidence on knee braces, generally the research shows that it's helpful with pain relief for osteoarthritis, but there isn't anything super conclusive about it. In other words, there's no protocol, there's no proven research that it fixes knee arthritis problems. It's just shown to provide some pain relief, but it doesn't necessarily stop the progression of arthritis or stop you from having a knee replacement if that's the path that you're on. I think the intent behind the braces is just to buy you some pain relief that's natural, you know, without having to take pain medications, without having to get an injection. And new braces like these are more modern braces. We're still researching these. There isn't much in the research about this because measuring the pressures on the inside and the outside of the knee is very challenging. So I think we'll see more research on knee unloader braces like these, but it's worth a shot, I think, in my opinion. If you can unload a certain compartment of your knee, that's beneficial. But even just for the blocks, these are really good blocks, you know, restrictions in motion to keep you from going into painful motions. I like this brace a lot for that feature. So the big question that everybody asks is, which brace should I get? Which one's going to help my knee arthritis? None of them are going to solve your knee arthritis problem. Let me make that super clear. Not one of these is going to fix your knee arthritis. You can't just buy a brace, slap it on, and expect your knee arthritis to be 100% better. That's not how this works. There's a process to fixing knee arthritis that usually takes help from a professional expert. We've got programs available on doing that. We've got many videos on our channel about all the different aspects related to the process of fixing knee arthritis problems. What you need to know is that it is possible to fix a knee arthritis problem and even get back to being very active, even exercising, running, depending on the severity. If you're very, very, very severe and you've got lots of limitations, you're probably not going to get back to like you were before, but at least you can improve your situation enough to where you feel better, possibly even better enough to avoid a knee replacement surgery. But if your arthritis is not that severe, it's more mild, even moderate, there's a good chance that you can improve the irritation, the inflammation inside your knee joints, and using a brace can be a part of that plan. And doing that in combination with doing other exercises, other activities, can get you to the point where you're feeling tremendously better. The underlying root problem of knee osteoarthritis is muscle imbalances. It's usually that the quad muscles on the front of the thigh are too strong and they're compressing the knee joint quite a bit. It's pulling the shin bone and the thigh bone, the femur, together and putting too much pressure on them and rubbing. These braces don't take off that pressure altogether. They might compress the joint. This one theoretically just offloads one side, but I think at the expense of compressing the other side long term. You've got to fix the muscle imbalance. That is the root problem that you've got to address. So in order to do that, you've got to figure out what exercises you need to be doing, what stage you're in arthritis too, because if you're in a very irritated state right now, then you can't be doing certain exercises that you might do at a later stage where you feel okay to do those exercises and they're actually going to be beneficial. So depending on where you are in your arthritis, you might need to do different things and you might not even need to use a brace long term. That's something that I do see people stuck in, is they say, I can't do anything without my brace. They're very dependent on a brace. And you know, if it works for them currently, great. If you're getting stuff done, fine. But I would be interested in solving the long-term problem, to which theoretically you should be able to not have to rely on a brace. It should feel fantastic to do all the simple things like walking, getting around the house, being able to squat down, kneel down to pick up stuff from the floor and do simple things. And ideally a brace shouldn't be part of your everyday life. So I hope this video was helpful for you. If it was, drop a comment below. Let us know that you liked it. Let us know if you have any other questions as well. Give us a thumbs up too. And don't forget to check out all the links in the description for all these braces in case you're shopping for a brace right now. I've also linked on there a playlist for all our knee arthritis videos in case you're looking for more help about solving the root problem. We've also got a program called the Knee Arthritis Recovery Program that's a comprehensive program that talks about all the different stages and what you should be doing at each stage throughout knee arthritis so that you can recover and get back to the activities you were doing before as best as possible. Thanks for watching, friends. I'll catch you in the next video. Bye-bye.